Hospital scenes, lab technicians in PPE, headlines reading COVID-25 variant detected, HX.1 linked to hospital surge, CDC issues warning. A new COVID-25 subvariant condemned HX.1 is spreading rapidly across the United States and health officials are watching closely. Linked to a sharp uptick in hospitalizations, the fast-moving strain is sparking renewed concern just as much of the public thought the pandemic was behind us. US map highlighting states with surge including California, Florida, Texas, and New York. According to the CDC, at least 17 states have now reported confirmed cases of HX1, with the highest concentrations in California, Texas, Florida, and New York. In some regions, hospitalizations have doubled in 2 weeks, especially among serious and people with pre-existing conditions. CDC official in press briefing, CDC spokesperson said that HX1 is showing signs of increased transmissibility and possible even more categories than previous Omicron lineage. Animation of virus mutation and spike protein changes. So what makes X1 very different? Experts have said that the new variant carries some mutations in the spike protein that help it evade exiting immunity both from earlier expression that infection and to some extent from current vaccines. The good news, so far HX1 does not appear more deadly, but its rapid spread could still strain the healthcare system, especially under vaccinated areas. Dr. Anthony Fauci, speaking in interview, Dr. Fauci said that we are not seeing a higher mortality rate, but the high transmission rate means even a small percentage of secure served cases can overwhelm hospitals. Pharmacies, people getting vaccinated, masks repairing in crowded areas. In response, local offices in Los Angeles, Chicago, and Miami are urging high-risk residents to wear masks in crowded indoor spaces, and the CDC is recommending updated booster shots for those over 65 or immunocompromised. Pharmaceutical companies are Moderna and Pfizer say reformulated vaccine targeting HX1 could be ready as early as October if the spread continues. Hospitalization over trends first month, slowing HX1 spike. While case numbers are still far below pandemic era peaks, ER visitors and ICU occupancy are rising steadily in some metro areas. Wastewater data, one of the early indicators of community spread, also shows a clear uptick in viral load nationwide. WHO official spokesperson said that we are monitoring HX1 closely. It's a reminder that COVID-19 remains a global health threat even in 2025. Schools preparing health protocols, business revisiting work from home policies. Some schools and employers are beginning to rethink their safety policies, especially with fall approaching when respiratory viruses trend to surge. For now, no federal mandates are being discussed, but officials say situational awareness and personal responsibility will be key in managing the new wave. COVID-25 H1X spreads fast. Stay informed, stay safe. As the HX1 variant spreads, health leaders argue that Americans to stay informed, stay vaccinated, and stay prepared because the virus is not just with us yet. We'll continue following the latest on the story.